Welcome to the last part of our antibiotic general considerations. In this segment, we will delve deeper into various aspects of antimicrobial therapy, including the combined use of antibiotics, prophylactic applications, and the potential challenges encountered in antibiotic treatment. Let's explore these topics to gain a comprehensive understanding of how antibiotics are utilized in clinical practice and the principles that guide their effective and responsible use. When it comes to treating infections with antibiotics, selecting the right one is crucial. Here's a breakdown of factors to consider. Patient factors. Age. Different age groups may react differently to antibiotics. For example, newborns may have inefficient elimination of chloramphenicol, leading to gray baby syndrome. Sulfonamides can cause kernicterus in newborns due to their effect on bilirubin levels. Aminoglycosides may have prolonged effects in the elderly, increasing the risk of nerve toxicity. Tetracyclines can affect teeth and bone development in children under 6. Renal and hepatic function. Patients with kidney or liver problems may need dosage adjustments or cautious use of certain antibiotics due to impaired elimination. Local factors. The conditions at the site of infection, such as the presence of pus, necrotic material, or foreign bodies, can affect the effectiveness of antibiotics. Drainage of abscesses and removal of foreign bodies may be necessary for optimal treatment. Drug allergy. Previous allergic reactions to antibiotics should be noted, as they may indicate which antibiotics to avoid in a patient. Impaired host defense. Patients with weakened immune systems may require more aggressive antibiotic therapy to combat infections effectively. Pregnancy. Antibiotics should be chosen carefully in pregnant women to minimize the risk to the fetus. Some antibiotics are safe, while others, like tetracyclines, are contraindicated due to potential harm to the mother and baby. Organism-related considerations. Clinical diagnosis. Sometimes, the clinical presentation of the infection can guide antibiotic choice, especially in conditions where the causative organism is known. Bacteriological examination. In cases where the infecting organism is unknown, bacterial culture and sensitivity testing can help determine the most effective antibiotic. However, empirical therapy may be necessary in some situations where immediate treatment is required. Drug factors. Spectrum of activity. The choice between narrow-spectrum and broad-spectrum antibiotics depends on the suspected pathogens and the need for empirical coverage. Type of activity. Bactericidal antibiotics directly kill bacteria, while bacteriostatic antibiotics prevent their growth. The choice between the two depends on the severity and type of infection. Sensitivity of the organism. The susceptibility of the infecting organism to the antibiotic should be considered based on MIC values and post-antibiotic effect. Relative toxicity. Less toxic antibiotics are preferred when available to minimize adverse effects. Pharmacokinetic profile. The pharmacokinetics of antibiotics, including their absorption, distribution, and elimination, influence their effectiveness. Factors such as peak concentration, time above MIC, and tissue penetration are important considerations. Route of administration. The route of administration should be chosen based on the severity of the infection and the patient's ability to tolerate oral versus parenteral antibiotics. Clinical efficacy. Evidence from clinical trials helps determine the efficacy of different antibiotics in treating specific infections. Cost. Cost-effective antibiotics should be preferred when efficacy and safety considerations are comparable. Choosing the right antibiotic requires careful consideration of these factors to ensure effective treatment while minimizing adverse effects and resistance development. In the world of antibiotics, the idea of more is better doesn't always hold true. Let's delve into the rationale behind combining antimicrobial agents and how it can impact treatment outcomes. 1. Achieving synergism. Combining two antibiotics from different classes can sometimes lead to a synergistic effect, where their combined action is greater than the sum of their individual effects. This can result in faster eradication of the infecting organism and reduced chances of relapse. Synergy is especially beneficial in treating infections that are difficult to cure with a single antibiotic. 2. Reducing adverse effects. In some cases, combining antibiotics synergistically allows for lower doses of each drug, thereby minimizing the risk of adverse effects associated with high doses. This is particularly important for antibiotics with narrow safety margins. 3. Preventing emergence of resistance. Using multiple antibiotics concurrently can hinder the development of resistance. Since mutations conferring resistance to one antibiotic are independent of those conferring resistance to another, the likelihood of a bacterium being resistant to both drugs is significantly reduced. This strategy is particularly effective in chronic infections requiring prolonged therapy. 4. Broadening the spectrum of activity. Combination therapy is essential for treating mixed infections involving multiple pathogens, especially when aerobic and anaerobic bacteria are present. Additionally, in severe infections where the causative organism is unknown, combining antibiotics with broad-spectrum coverage improves the likelihood of successful treatment. Disadvantages of combination therapy. Casual diagnosis. Relying solely on combination therapy without proper diagnosis may lead to overuse of antibiotics and promote antibiotic resistance. Increased adverse effects. Combining antibiotics can sometimes enhance their toxic effects, leading to a higher incidence and variety of adverse reactions. Superinfections. Prolonged or inappropriate use of combination therapy may disrupt the normal microbial flora, increasing the risk of secondary infections. Emergence of resistance. If inadequate doses of non-synergistic drugs are used, there's a risk of promoting the emergence of resistant strains. Higher cost. Using multiple antibiotics simultaneously can increase the overall cost of therapy. In conclusion, while combination therapy can be beneficial in certain scenarios, it should be used judiciously and based on a thorough understanding of the infection and the antibiotics involved. Remember, the goal is to maximize effectiveness while minimizing the risks and costs associated with treatment. Prophylactic use of antibiotics is a critical strategy aimed at preventing infections before they take hold or suppressing them before they become clinically apparent. While this approach can be highly effective in certain circumstances, it's essential to recognize when it's appropriate and when it may do more harm than good. Here's a breakdown of the valid and improper uses of prophylactic antibiotics. 1. Prophylaxis against specific organisms. For diseases like rheumatic fever, tuberculosis, and HIV, targeted prophylaxis with specific antibiotics is highly effective in preventing infections caused by known pathogens. Examples include penicillin for rheumatic fever, isoniazid for tuberculosis, and azithromycin for Mycobacterium avium complex MAC infections in HIV/AIDS patients. 2. Prevention of infection in high-risk situations. Certain medical procedures, such as dental extractions and urinary tract instrumentation, can increase the risk of infection. Prophylactic antibiotics may be warranted in these cases to minimize the risk. For example, patients with valvular defects may receive antibiotics before dental procedures to prevent endocarditis, and those undergoing urinary catheterization may receive antibiotics to prevent urinary tract infections. 3. Prevention of surgical site infections (SSI). Antibiotic prophylaxis is commonly used in surgical settings to reduce the risk of SSI. The selection, timing, and duration of prophylactic medication are crucial for maximizing effectiveness while minimizing adverse effects. Prophylactic antibiotics should be administered shortly before surgery, with peak blood levels coinciding with the time of incision. They are generally not required for clean surgeries, but may be necessary for procedures involving prosthetic insertion or in high-risk patients. Commonly used antibiotics for surgical prophylaxis include cefazolin, vancomycin, and clindamycin, tailored to the specific procedure and patient characteristics. 4. Prevention of infection in general. Prophylactic antibiotics are often misused in situations where there is no clear indication or benefit. Examples include neonatal prophylaxis, postpartum infections, and viral upper respiratory tract infections. In these cases, the risks of promoting antibiotic resistance and causing adverse effects outweigh any potential benefits of prophylactic therapy. Understanding the appropriate use of prophylactic antibiotics is crucial for optimizing their effectiveness while minimizing the risks associated with their use. By using antibiotics judiciously and based on evidence-based guidelines, we can help prevent infections and preserve the efficacy of these life-saving medications. As we conclude our exploration of antimicrobial general considerations, it's clear that antibiotics are invaluable tools in the fight against infectious diseases. Yet, their judicious use, guided by evidence-based practices, is essential to preserve their efficacy for generations to come. By staying vigilant, informed, and mindful of the principles discussed, we can optimize antimicrobial therapy and safeguard public health. Thank you for joining us on this journey. Please like, share, and subscribe to our channel for more pharmacology video.